Hi and welcome everyone. Today is the let's talk about it, learning about Medicare 101.
Let me see if I can get down here.
That's okay. Yeah, yours is muted. Okay. Thank you all for attending. Tonight's program will be recorded. So if you want to come back and watch it again, it should be uploaded on your local chapter's website. Tonight we'll be hearing from Yvonne Peterson about learning about Medicare. I'm going to go ahead and turn it over to Yvonne.
Good evening. Oh, you're good. Yeah, we're getting a little feedback. We've had electrical difficulties today, so I'm sitting here with Rebecca in her dining room. Uh, okay, gotcha. Okay. All right, we're going to talk some about the basics of Medicare, and all of the information you ever want to know is in your Medicare and You 2021 book. Uh, that's in print. It also is online, and some of it is in audio form. But I'll just be doing a condensed version for you tonight. And basically, what I'm going to be going over are the four parts of Medicare, which is A, B, C, D, Medigap policy, enrollment periods, and penalties. Uh, and yeah, I'm good there. Yeah. And each year you should check your book and see what changes have been in front of the book. It will tell you what changes have been for that year. And we should be getting new information by the next enrollment period, which will be the middle of October. Uh, Medicare is a federal health insurance plan, and it was implemented in 1966 for persons 65.
You have to share I'll share the PowerPoint.
Oh, okay. Yeah. You want to share the?
Yeah, I thought you were going to share. That's what I
Oh, I'm sorry. Okay. Just bear with us.
Give me 2 seconds.
Okay. Yeah.
Okay.
Well, it says I'm muted. Rebecca's getting up the PowerPoint here, but it's a federal health insurance plan that was implemented in 1966 for persons 65. That's only people it covered then. In 1972, people who were on Social Security disability were allowed to get Medicare. And in 97, they implemented the Part C plans, which we'll talk about tonight. And then it got a drug component until in 2006. So until that time, there was no plan for your drugs. You, when you get onto Medicare, you have two options. You can either go with traditional or original, which we'll discuss, which is Part A and B, or you can go with the managed plan, which is C, and are managed by private insurance companies. Next slide, Rebecca. Okay, and Part A is your inpatient hospital care, and I will make a distinguishment between inpatient admission versus admission for observation, because that can make quite a bit of money difference. But Part A includes your in-hospital care, your skilled nursing facilities, hospice, and home health. Part B also covers some home health. This is managed by Medicare, and your Part A premiums were paid by those FICA taxes that came out of your paycheck for all those years. You have to have been employed for a minimum of 40 quarters, which is 10 years, to have free Part A, but most people do have that. Otherwise, you may have a premium of anywhere from $259 to $471 for that part. On the inpatient admission, sometimes that word is used a little loosely in hospitals. A lot of people think because they're in the hospital overnight that they're admitted and a full patient, and they may not be. They may just be admitted for observation. But if you're admitted, you have to be in hospital for 2 midnights. That's the basis part of it. And the doctors say you're fully admitted, because if not, you would be out. If you just have traditional Medicare Part A and B, you would be out $1,400 for what's called a benefit deductible. And that, unfortunately, that benefit deductible is not just a one-time cost in a year. It may be repeated every 60 days. So theoretically, in a year, you could have that cost 7 times. And Part A only covers semi-private rooms unless there's a special medical condition. That might be something like a transplant patient or something like that, but otherwise it's only for a semi-private room. And that's the true when you're in a skilled nursing care facility. And also on skilled nursing facilities, they only pay when you need skilled nursing care. That is not custodial care in a nursing home. Your Medicare B will help pay for about 20 days in a nursing home, but that again has to be for skilled care. Your Part B is doctors and other healthcare providers, outpatient care, outpatient lab, which if it's an approved lab service is paid at 100%. Some home health, durable medical equipment, wheelchairs, nebulizers, hospital beds, and certain Part B medications. Usually those are medications that need to be infused, like chemo, IV gamma for certain things. It also includes preventative services like mammograms, prostate screening. There's multiple: alcohol screening, diabetic screening, bone density tests, those sorts of things. It is managed by Medicare, and your premiums, unless you make over $87,000 a year per individual, your premiums are $148 a month in 2021. Your premiums are increased if you make over that. That's for your Part B and for your Part D. Next slide.
How it goes up if we don't get Part B?
Oh yeah, well, I think we've got that included in the penalties, but yeah, and there is a penalty if you don't sign up on time, and we'll go into that in the enrollment periods. And on Part C, next slide, Rebecca. Yeah, okay. These are the Medicare Advantage plans, and they private company contracts with Medicare to help you manage your health care. These are what's known as HMOs, PPOs, preferred provider organizations, or PFFS, or a medical savings account. Not to be confused when we get to the medical savings programs, which are different type programs. There's also what they call SNPs, which are for special need plans, and these would cover people who say have congestive heart failure or diabetes or are on dialysis or things like that. Those are special plans that help to manage those. To participate in a Medicare Advantage plan, which sometimes people call them MAPs, you would need to have both your A and B and keep paying your B. Now, some companies will pay part of your B premium or all of your B premium, and it's something you need to ask when you're shopping. But you cannot be enrolled in an employer health plan if you're still working and a Medicare C plan at the same time. That's a little bit different than traditional Medicare, because with traditional Medicare, you can still do that. One word of caution about a Part C, if you're looking at it, is that if you're on a list for a transplant, you might not want to change at that time to a Plan C because you might lose your place on your list. And you might have to change your doctors. Okay, next slide, Rebecca. Okay. Okay, this is a sample of, and these are from the state of Texas. Each state has different programs, and if you'll notice in here, these are in geographic regions, and in the larger cities like Austin, Houston, whatever, you'll notice that in the, well, it gives the service area, the second column is a monthly premium. And for some reason, this page I picked has all 0 monthly premiums, so that's pretty good. But the out-of-pocket limits, if you will look, vary. That's the third column. When you have, like in the Austin metro area, that's the first one that's listed there, you have 2 costs, like $6,400 and $10,000. That is with a PPO, and that means whether you're in network or out of network. So the highest cost would be if you're out of network. All plans do not allow you to go out of network, and that can be an issue for some people. The rest of the columns there, the primary care visit, whatever, it just tells you what the cost and percentage would be. And Medicare C does cover the basics that Medicare A and B, the traditional, cover. It does, if you'll notice the cost on that top one, it's for in-network and out-network. Okay, this is where you need to be careful, because on your annual D deductible and your D drugs, they are not covered. I mean, they cover it. They're included with the plan, but your maximum out of pocket, that $6,400 back in column 3, does not include that. So you may get, you may have some, you will have additional that you will be paying above 6,400 if you're using managed plan. Yeah. You will have, in this case, this plan has a deductible of $345, and it says for some drugs. Well, you definitely need to speak to the plan about that, because on some plans, all your drugs don't count towards meeting your deductible. So that could be a little tricky sometimes. And I think this one, on this page, all of these say, yes, they have other benefits. And if you look in, some of the smaller areas here, like El Paso County, maximum out of pocket is $3,700 a year. So the ranges, and that will be true no matter what state you're in, because these policies vary by state. They also vary by the county, just like your health. I mean, just like your automobile and your household insurance does. Particularly those of us on the coast, it's almost prohibitive and impossible sometimes to get flood insurance. But be sure that you do understand that that maximum out of pocket that is in column 3 does not include your drug cost. One of the issues with the Medicare Advantage plans, the Plan Cs, is if they have the drug plan included with them, which most of them do, you have a choice to make, um, choosing whether to go by the medical that's offered and the copays, or by your drugs that's covered. And you do need to make sure that all your drugs are covered, unless you want to be really paying a lot of money out of your pocket otherwise. With the traditional Medicare, you choose your own drug plan. And you have to see if the benefits, some people choose a plan just based on the benefits. Like, if they belong to a gym or Silver Sneakers, or they provide lunch, or, I mean, they provide meals when you're sick, or transportation. But for most of the people, I imagine, that's on here tonight, they have some health issues, and that may or may not be the most important thing to them. I know with my years of disability, having my medications paid for and having basic medical has been my most important things for me. I'm going to quickly contrast the the original Medicare, which is just the Part A and B and the D separately, with the managed plans, and which generally include your Part D. The
Do I need
the
to change screens?
No, you don't need to change yet. The original Medicare, those plans are nationwide. Any doctor will accept you nationwide, just about. I mean, as long as they take Medicare. With managed plans, there are geographic restrictions. Say you lived in Austin metro area like we had here, and you moved across the border to New Mexico, your plan might not be covered. I mean, you might have to change insurance companies. Uh, with original Medicare, there's no networks. You usually, very rare would you ever need a referral. With managed plans, there's networks, and you almost always need a referral, which can cause you some delays in getting treatment sometimes. A downside of original Medicare, there's no maximum out-of-pocket cost like uh, you see here on these plans, on the managed plans. However, you can buy something called a Medigap policy, or in some states, it's called a Medicare Select policy for secondary and full coverage. With a Medicare Advantage plan, you cannot have any other health care plan as a secondary to pick up those costs, to pick up, say, in that Austin Metro plan, that's $6,400. You cannot do that. With original Medicare, you purchase your Plan D separately, and with the managed plans, usually the D is included, and you have no choice about that. Um, there in managed plans, providers come and go. Some stay longer, and some maybe don't even fulfill their contract year. With original Medicare, usually you have a little more stability and long-term relationships with your providers. The original Medicare also sends out something quarterly called a Medicare summary notice, and the other companies, the managed plans, they provide that, and they may call it something else, but the summary notices just tells how much that they have paid on your behalf for the year. With original Medicare, there are no extras like fitness plans or meals or transportation or anything like that. Yeah, next slide. Yeah. Medicare Part D, this is your prescription plan, and these are managed by private insurance companies contracted with Medicare, and they may be part of a bundle plan like I just spoke about with your Plan C, except for what's called the medical savings accounts, and all of those have to be purchased separately, just like it is for original Medicare. Again, the premiums will vary by the company you select, and there are penalties. And these, when we say penalties, like on B as in boy, or D as in dog, drug, these are lifetime penalties if you don't take them when you're first eligible for them, unless you have something called other credible coverage. Other credible coverage would be Medicaid, union or retirement insurance, or veterans. Credible coverage means that the coverage is equal to or better than the plan that Medicare would be offering you. Uh, if you do have one of those plans, I advise you to also check and see how much a Part D with Medicare would cost you, because sometimes, even though it's something that comes and maybe comes as a discount with your previous employer, it may not be as good a deal as what you can get through the Medicare D plans. Uh, The next slide is just going to be a comparison. And Medicare .gov has their very, I find it easy website, and I'm certainly not a technological person. So they're very, if I say it's easy, it's easy. And this is how they compare your prescription drug plans. You set up an account. I mean, you set up an account with them, and then you put in all your medications, and they will compare up to 3 drug plans at a time. If you'll look, it's given in this example 3 drug plans, and they all have different monthly premiums, and they all have different deductibles. Well, when you look down at the bottom, though, the cheapest plan is the HEB pharmacy in the left column for $2,753 for these same drugs. The most expensive plan, and it goes cheapest at the top down to the bottom, and then and works its way over. For the same prescriptions at another pharmacy, it could cost you $8,000 for the very same prescriptions. So, and if you'll note on there, it talks about standard in-network pharmacies and then preferred in-network pharmacies. Well, you want to make sure that you've checked a preferred in-network pharmacy. But even with that, like this year with my plan, I compared 2 preferred in-network pharmacies, and one of them came out $500 cheaper than the other preferred network pharmacy, and they're about 1.5 miles apart. So that was very interesting to me, because usually the preferred pharmacies have the best prices, period. But a lot of this cost difference depends on what pharmaceutical manufacturers that these insurance companies, because these are all private insurance companies that are negotiating here, have negotiated. And in every category of drugs, any plan that is sold under Plan D does have to have a minimum of 2 drugs in every category. And they also have to include, every plan has to have HIV drugs, cancer drugs, seizure drugs, immunosuppressant drugs, and antidepressants, and I've forgotten the 6th one. So I apologize if anybody wants to know what that category is, but in all the other categories of drugs like antibiotics, antidiarrheals, whatever, anti-nausea pills, any of these plans have to have at least 2 choices. If you want to go on to the next one, Rebecca. Okay. One of the things, though, when you look at your drug plans, I'm sorry, I probably had to remove that too fast, but that's okay. When you look at your drug plans, make sure that there's not a lot of prior authorizations on there, because what will happen with that is many of the physicians anymore won't even write for prior authorizations. Or if they do write, they're charging you $25 to $35 for a letter. That's in this area. If you're in another state, I don't know, it may be more or less, but some of them have just given up, and they say, I've not had any luck with them, and we're not going to write any more of them. So make sure that you don't have a lot of what's listed as prior authorization, right? Often when you look up your drugs, you will see terms like quantity limits and those sorts of things, and just make sure that quantity limit suits what you need. There are 4 stages of 3 to 4 stages of drugs. When you're in your drug plan, there's the deductible stage. If your plan has a deductible, there is a initial stage, and after you've spent so much, then you move on up. I can't remember. See, I didn't give that to you, Rebecca, and I don't have it. But I don't know what 2022's amounts will be, but they I'm sorry, people. This has been kind of a scattered afternoon, and I can't find this note where I wrote the amounts of money for you to reach each stage. But the first stage you go through, it's what you, your plan, and your any third party paid for you, and I believe it's a little over 4,000. The second stage is something called the donut hole, and you're in that stage until what you've paid, just what you've paid, reaches over 6,000. And in that stage, the drugs are 25% of what that pharmacy, I mean, what that plan charges. So that can be pretty expensive. And then after that, you get, if you reach that level, you get into something called catastrophic stage, and the drugs go down considerably. But yeah, the drugs, and sometimes we have some slides in here, and they will be getting copies of these. You will be getting copies of these slides, but there are some things too with extra help. So I'm ready to move on, Rebecca, to the next, which is the Medigap. Okay. Medigap policies are supplemental policies, or some states call them Medicare Secure, are sold by private insurance companies. And there is no extra assistance from any organization as a rule for help with paying for these premiums. The premiums vary according to the company and to the type of plan that you that you take out. Also, these plans are lettered by alphabet, so don't confuse them with the parts of Medicare, which are A, B, C, D. And these plans have alphabetical names too. So, and I see in here on this, I have the different plans are in Section 5 of Medicare and You. And the type of plan, if you have an A plan, if you have a B plan or whatever, those are consistent from state to state. Did you get this one in?
Yeah, we saw it.
Yeah, did we see that? No, this, yeah.
Yes. That's it.
Oh, that's it. Oh, okay. Okay. Right. All right. Okay.
So it's consistent state to state.
Yeah, it's consistent state to state. Since January of 2020, plans F and G, I'm sorry, C and F are no longer available for people just new coming into Medicare. And if you, like say, they're even in different counties, say now, like I have Blue Cross Blue Shield, I have a plan G this year, but say I were in a smaller county, that plan would probably be cheaper than what I pay here in Harris County. I personally shop with a Medicare agent to shop, and if you choose one, make sure you choose someone that sells plans from different companies, because they can shop better for you, not just a salesperson that works for one company. And it certainly doesn't cost you anything to shop with an agent for a Medigap policy, a plan D, that's the drug plan, or for your Medicare Advantage plans. But if you'll look at the top column, it shows every one of them covers 100% for Medicare A coinsurance. So that expensive benefit that I was talking, benefit period about the hospitalization I talked to you about earlier, if you have a Medigap policy, it covers it at 100%. It's when you get to the Medicare Part B coinsurance where the co-payments and things are a little bit different. When you go to K and L, they have reduced payment, and to the blood, the hospice, etc. Unfortunately for disabled persons in the state of Texas, the only Medigap plan that you're eligible for is Plan A, which it has no coverage for skilled nursing facility co-insurance. The first 20 days in the skilled nursing facility are all on Medicare A, but after that, there is a copay that could get pretty expensive. Now, you do have the option of going with the Medicare Advantage plans, but I would have to do some serious calculation before I would consider advising anyone to take a plan A unless they have some other type of coverage to go with that, and I don't think you can do that. So, not that I advise people what to take, but I would be a little concerned if I had chronic health problems about it not paying the Medicare Part A deductible, which was at $1,400 if you go to the hospital. That could be repeated every 60 days if you unfortunately went to the hospital every 60 days. So that is something seriously to consider. Okay, now we're going to talk a little bit about enrollments. You enroll for Medicare. If you're enrolling because you're 65, there's a 7-month initial enrollment period, and that is 3 months before your birthday month, the month of your birthday, and 3 months after your birthday. If you are getting on Medicare because you are 65, my advice is to enroll in Medicare the first month that you're eligible, which would be 3 months before, and that way you'll be eligible for Medicare in your birthday month. But if you wait till 3 months after, then you're not going to be getting Medicare until probably 6 months after your birthday. For those who are on disability, your 25th month of disability, you're automatically enrolled into Medicare. If that's the situation for you, I would encourage you at month 20 and 21 of your disability to begin to shop, even though the plans may change for the next year or whatever, to begin to actively seek information through in our resource list we have, like with the SHIP department, or you can call some of the individual companies you think you might be interested in and start looking, because it does take a long time to maybe choose the best for you. And particularly if you have health problems, sometimes all it takes is a flare up for a week to get expanded into a month or something like that before you feel like picking back up those papers. So if you are on Medicare, if you are on Social Security, like I say, when you get on for disability, you'll automatically be enrolled in Medicare. The others who are not receiving Social Security will need to contact Social Security Social Security benefits to enroll, like if you're still working or something like that and you want to work past 65. And this about delaying enrollment is actually for people who are 65. There would be no reason for anyone on disability to delay enrollment. There are two special categories, and that's with end-stage renal disease and ALS. They are different. The qualification periods for those are different, and so you would need to contact the Social Security office. Also, on compassionate care, people can begin to get their Social Security. Compassionate care is for people with cancer that they don't expect to live long, but they're still not eligible for their Medicare. Yeah, for 2 years, 24 months. So if anybody has, and if any of you have any employee or retirement healthcare coverage, or veterans or railroad or anything like that, or something from a spouse or whatever, make sure you consult with Medicare and the Human Resource Department about what's the best way for you to manage this. Some of the things depend on even how many people are employed by that person, as who would pay first and who would pay second, and whether it's even advisable to continue with it. Okay, we go on to the late enrollment period, which I hope no one finds himself in a late enrollment period. You get a penalty if you do not enroll in Medicare A and B and the prescription drug coverage when they're first eligible to you, and you did not have some other type of, I explained about the credible coverage. And these penalties are for a lifetime. They're not just one time or 1 month or whatever. Part B, and I'm going to read this, enrollment penalty is 10% additional premium for each full 12 months period that you did not have coverage. So, and there are people who sometimes do this. So if you missed 2 years, that would be 24 months, then your additional premium would be about 20%. Yeah, would be 20% of 148, which would be approximately an additional $30 a month for the rest of your life. So at 360, that would be $360 a year, and in 10 years that would be $3,600. So I mean, depending on how long you intend to live, and I hope longer than that, but I'm just saying that it's something you really don't want to incur. On Part D, the late enrollment penalty is 1% of the national base rate premium, which in 2021 they figured was $33. So times the number of full uncovered months. Well, what you really essentially have then is 12%. Well, you have 12 times that each month, and then times each year. And over a lifetime, that will add up too. I'm going to just backtrack just a minute, and on Medigap policies, or supplemental policies as they're called, you must enroll in that if you're going to enroll in one within 6 months of getting your Medicare. If you do not, you're not guaranteed what they call issue. You may have to fill out a health questionnaire. But otherwise, in that first 6 months, you're guaranteed that you can get that policy. If you ever drop it and want to come back to it, you may or may not get that policy because you'll have to answer health questions. And that sometimes can be a problem. Okay, general enrollment period. If you miss your initial enrollment period and have no credible coverage, you must wait until the general enrollment period to sign up for Medicare A and B, which is January 1st to March 31st, with coverage not starting until July. Say you had a July 1st birthday this year, you could have signed up in April of 2021. And you did not. You didn't sign up July 1st, and you didn't sign up by September the 1st. That's your 7 months there. 6 months, 1 more month. Okay. Then you will not be able to sign up till January or through March, and then your coverage won't start until next July. So you could possibly miss a whole year of coverage there. And so make sure you follow these, follow the enrollment periods and watch those closely. One other thing, though, you can do in January through March, if you purchased in October through December, if you purchased a Medicare Advantage plan and you get enrolled in that plan and you find out it's not what you thought it was, you have the option of in changing a Medicare C plan, the Advantage plan. You can do that. So and down at the bottom it says open enrollment, and that will be our next enrollment period coming up. That's when those of us who have original Medicare, like I do, will be purchasing my Part D prescription coverage. For those who want to change coverage on their D or else go with a Medicare C plan, that's the time to do it. And then your coverage doesn't start until the calendar year. Okay. Okay.
Next one.
Yeah, okay, yeah, Part B, yeah.
Mhm.
Okay. For your Part B outpatient care enrollment, you enroll on your 65th birthday or your 25th month of disability. And like I say, it's not too soon to start shopping at month 20 or 21 of disability. And we just discussed the premium, the penalty for late payment. And you can either make an appointment with Social Security. Wait, I'm sorry. I'm sorry. There's 2 or 3 ways to go about enrolling if you need to enroll if you're 65. If you're disabled, you don't have to worry about this, but you can either sign up online or you can go into the office. So anyway, we'll go on to next one, Rebecca.
Mhm.
Okay, these are special enrollments, and I will read off of here. If you this is what happens. These are special enrollments, usually for people who are getting extra help or for Medicare C, the managed plans. You permanently move out of your plan service area. You lose other credible prescription coverage, like from your retirement benefits or whatever. You weren't adequately told that your other coverage wasn't credible, or other coverage was reduced and no longer available. You enter, live at, or leave a long-term care facility. You qualify for extra help. If you qualify for extra help, and we're going to discuss that in a minute, you can change once a calendar quarter. So 4 times a year, you can change your drug plan. Or if you find or switch to a plan, a Medicare C plan that has a 5-star rating. At this time, I think there's only one 5-star rating plan in the state of Texas. If you belong to state pharmaceutical assistance program, which in Texas, the only drugs in that program are for HIV and end-stage renal, or there's other exceptional circumstances. And while I'm talking about exceptional circumstances, many of these rules in Medicare, just like everything else, there may be exceptions. So if you're dealing with an issue, whether it's with Medicare or any other thing in life, sometimes you just have to ask the question, is there an exception to this? If there is, would you explain it to me? So I think we've finished the enrollment periods, and we're going to discuss
Prescription cost assistance.
Prescription cost assistance. Okay. If you are already on SNAP, which is food stamps, that's what they call them in this state, or EBT card, whatever. If you're on SNAP or if you're on you automatically would get prescription drug assistance, and you should get something called a purple letter, and it's actually on purple paper. There are some other plans for people. It's called Medicare Extra Help, and it's for those with a monthly income of less in 2021 of less than $1,630 for an individual, or $2,198 for a couple. And your resources are limited to bank accounts to 14,790, and there's more for a couple. Different states, if it's a high cost of living there, like Alaska or Hawaii, it may be a little different. So you need to be to ask if there's an exception on those. And if your income changes at any time during the year and you haven't maybe signed up for any of those, then perhaps you should you need to sign up for those. and anytime your income goes down. Also, if you're making over 87,000 a year and your Part B premiums, if your income goes down, you certainly can get those reduced. Uh, if it goes up more, then there's other categories, and you may be paying more. I know some people who pay between $400 and $500 a month for Medicare B premiums. Do we have another slide, Rebecca?
On the Medicare savings?
Yes,
program?
yes. Medicare savings programs. Yes, this is good. Now this is in the lower income, but it helps with Part A premiums, Part B premiums, Part A and B deductibles, co-insurance, and co-pays. The next category is for Medicare beneficiaries, but it's reduced. I mean, the income limits are higher, but it only pays for Medicare Part B premiums. But that's still a nice $148 a month bonus that you would get there. And you can see the limits for the your resources, and also at the bottom it says, there's an exception if you're supporting other family members in your home or you have income from still working. So it's always worth trying to see if there's an exception. And for those who don't meet those qualifications, who you're just a few dollars above whatever, we have a list of resources that may be able to help you. Now, the resources for additional information, I'm sorry, the first one is for it's free personalized counseling for with Medicare advisors to help you decide on a plan. But for other things to help you save money, dental schools or universities for reduced fees. I don't know in other states, but here in Texas, ours is not free and it's not sliding scale, but it's certainly reduced. And for those with lupus and medically complex issues, you do get the students that are getting ready to graduate. So, and then they do have graduate programs, which are a little bit more. There are patient assistance programs from individual pharmaceutical companies for drug assistance, like Genentech covers CellCept. Um, I'm going to reflect back just a little bit to Medicare B drugs. If you're on CellCept because you've had a transplant, Medicare B, as in boy, will pay for that drug. If you're on CellCept because your doctor is trying to protect your kidneys and you have not, or suppress your immune system with your lupus, that drug would have to be covered under D, as in dog. Okay, and when you're looking for a patient assistance program with a pharmaceutical company, your pharmacist or doctor may be able to help you find the contact information if you're unable to. You also can take your formulary to the doctor and let them prescribe the lowest cost-effective drug. That helps sometimes to save some medication. I know for myself with my blood pressure drugs, now I'm on a very old but very cheap drug that's working much better than some of the more expensive ones I had. Any drugs that may not be covered, say sometimes you get a prescription in the middle of the year and it's not covered under the plan you have. Do competitive price matching and shopping. And Sam's and Costco, you do not have to be a member of Sam's or Costco to use their pharmacies there. On some things, I find them cheaper, on others, may not. And then there's still the good old samples from the doctor's office or a pharmacy management program offered by your Plan D. And I think, Rebecca,
Okay. Let's see.
I'm not quite sure where we are on time. Oh, good.
Okay, I think we only had one question, and that was, how do you start Medicare if you're completely handicapped? What are the barriers to applying for Medicare? So I think we answered that in our presentation, but Yvonne, I'm going to let you answer that again. This is for someone who's completely handicapped. How do they start Medicare?
Okay. And then too, Rebecca, down in the chat, I see a question. But actually, you have to be declared disabled by Social Security, not your employer or not some personal disability policy, or not even the Veterans Administration, because that's separate from Social Security. So you have to be declared by Social Security. There is no barrier to getting Medicare once you've been disabled for 25 months. The barrier probably comes for most people in getting their Social Security disability. So I'm not quite sure exactly what the person meant by that question. And, you know, sometimes Medicare, Social Security in different parts of the country is very difficult to get, and I'll address that right quick. Say here in Harris County, and this is true any place, they go by your age, they go by your education, they go by your medical issues, and they go by the jobs available in the general economy. So here in Harris County, because of the jobs available, a person could have the very same problems, age, and education another person has, say, up in one of our more rural areas here, say Polk County, and one could get disability and the other could not. So it's not just your medical condition, but there's other factors that they look at. And high school education is considered educated. So any above that is going to diminish your chances. It's not impossible, but it just diminishes your chances.
Okay, next question. I was automatically enrolled by SSDI in California. Automatically enrolled by SSDI in California. Is this different state to state? My payment comes right out of my disability check.
Okay, Rebecca, I'm getting feedback and I'm having a little trouble.
I think you need to turn your volume.
Yeah, I turned mine off. Okay. All right, now would you repeat the question?
Sure. I was automatically enrolled in SSDI in California. Is this different state to state? My payment comes right out of my disability check.
Okay. SSDI is the same state to state. SSI, which I did not mention just a minute ago, SSI is for people who haven't worked, who are disabled, or they didn't make very much. And it's not SSDI, but no, SSDI is the same state to state. SSI is different in different states. It's part federal and it's part state program, but SSDI is a federal program and it should be the same. Now my premiums come out of my Social Security check for my Medicare B, and I opt to have my premiums for Medicare D, as in dog, taken out of there. But that's standard across the nation. So I'm not quite sure what you're saying comes out of your check. If it comes out, it's your premium. It should be your Medicare B premium that's coming out of your Social Security disability check, your SSDI. Is that correct?
Perhaps. I guess maybe she's not on anymore, but I guess that's the best we can answer a question. Thank you, everyone. I don't see any other questions, but you can always contact your local chapter. Oh, she said yes. Okay, great. Yes. Oh, she said yes. Okay, great. Yes, it's my premium. You can always contact your local chapter with questions, and they can forward them to us if you think of anything later. We appreciate you all attending tonight, and thank you, Yvonne, for presenting on this very informative and complicated topic.
I am, let's see, I am available if you want to contact through Rebecca and the Gulf Coast chapter. If there's something after you get the notes and look at them tonight, you have a question about, I certainly am open to discussing that with you.
I just put in our general email if you have questions at info@lupustexas.org, but you can also contact your local chapter where you sign up. And again, this is recorded tonight, so if you want to go back and rewatch something, it should be uploaded on your local chapter's website. Thank you.
Thank you, and thank you for being patient with us. I had a storm blow out the transformer in my neighborhood, so I had to come over to Rebecca's and sit with her. That's how we got the feedback tonight and the speakers, but thank you for your patience, and I hope that's helped you.
Thank you.
Okay.